For 20 years, Dr. Michael Preston prided himself on making split-second decisions in Boston General's emergency room. His instincts were legendary, his diagnostic skills unmatched. Until the night, a Harvard neurobiologist came in clutching his chest, and Preston hesitated. A pause that would shatter everything he thought he knew about medicine. Sometimes the most dangerous symptom is the one we refuse to see in ourselves. Dr. Michael Preston stood at the nurse's station of Boston General's emergency department, scanning a patient chart with practiced efficiency. 20 years of emergency medicine had taught him to read between the lines, to anticipate complications before they arose, to trust his instincts above all else. "Room 12 needs immediate attention," Nurse Carmen Rodriguez said, sliding another chart across the counter. "Patients complaining of chest pain, shortness of breath. BP's elevated." Preston barely glanced at the chart. "I'm already handling 3 critical cases. Have Dr. Chen take it." "She's in trauma. You're the only attending available." Carmen's dark eyes fixed on him with the particular intensity she reserved for difficult moments. "Sir, the patient's been waiting for 40 minutes. Preston sighed, reaching for the chart. His eyes skimmed the basics. Marcus Johnson, 45, professor of neurobiology at Harvard Medical School. Chief complaint: chest pain and difficulty breathing. The vital signs were concerning. Blood pressure being 168/95, heart rate elevated. "Fine," he muttered, "but get that drunk in room 8 ready for discharge. I don't want him taking up a bed all night." The walk to room 12 was interrupted twice, once by an intern with questions about a medication order, once by a family demanding updates about their grandmother. By the time Preston pushed open the door, his patience was wearing thin. The man sitting on the examination table looked nothing like what Preston expected. Marcus Johnson wore wire-rimmed glasses and a carefully pressed Oxford shirt, now wrinkled from waiting. His posture was rigid with pain or anxiety, possibly both. A worn leather briefcase sat beside him, papers spilling out as if he'd been trying to work despite his symptoms. "Mr. Johnson," Preston said, keeping his eyes on the chart, "I'm Dr. Preston. What brings you in today?" "Dr. Johnson," the man corrected quietly, "and I believe I'm having a cardiac event." Something in his tone made Preston look up sharply. The patient's face was sheened with sweat, his breathing shallow, but it was his eyes that caught Preston's attention, keen and evaluating, taking in every detail of their interaction. "I've been experiencing chest pain for approximately 2 hours," Johnson continued, his voice clinical despite his obvious discomfort. "Radiating to the left arm, accompanied by dyspnea and diaphoresis. Given my family history of early-onset coronary artery disease, I thought it prudent to seek evaluation." Preston felt a familiar resistance rise within him, the automatic bristling at being assessed by a patient, even one with medical knowledge. He'd seen it countless times. People who thought their internet research or even their medical degrees made them experts in emergency medicine. "I'll be the judge of what's happening here," Preston said curtly. "Lie back and let me examine you." Johnson complied, but those observant eyes never left Preston's face. "Of course, though I should mention I'm also experiencing nausea and—" "I'll conduct a thorough examination," Preston interrupted, reaching for his stethoscope. But as he stepped forward, he found himself hesitating. Something about this patient made him uncomfortable, though he couldn't quite name why. In the doorway, Carmen appeared with an EKG machine. Her expression was carefully neutral, but Preston knew that look. She was watching him just as Johnson was watching him. "Your initial troponin results are pending," Preston said, forcing himself to focus on the chart rather than the growing tension in the room. "Once we have those and the EKG—" "Dr. Preston," Johnson's voice had grown softer, strained. "I don't mean to overstep, but given my symptoms and risk factors, wouldn't it be prudent to start nitro while we wait for the results?" Preston felt his jaw tighten. "As I said, I'll be the judge of—" "Michael?" Carmen's voice cut through his rising irritation. She never used his first name at work. "A word outside?" In the hallway, Carmen closed the door carefully behind them. "What's going on in there?" "Nothing's going on. The patient is being difficult. The patient is a respected physician presenting with textbook cardiac symptoms, and you haven't even put your stethoscope on him yet." Carmen's voice was low but intense. "I've worked with you for 12 years, Michael. I've never seen you like this with a patient before." Preston opened his mouth to argue, then closed it. She was right. He hadn't even begun a proper examination. But why? What was making him keep his distance, maintain this strange barrier between himself and room 12? Through the door's window, he could see Johnson closing his eyes against what appeared to be another wave of pain. The man's hand clutched his chest, his breathing growing more labored, and suddenly Preston remembered another emergency room 20 years ago when he was just starting his residency. It had been Cook County Hospital in Chicago, his first solo overnight shift as a resident. A man had come in with similar symptoms, well-dressed, articulate, educated. Preston had hesitated then too, second-guessing both the patient's self-reported symptoms and his own instincts. By the time he'd overcome his inexplicable reluctance, by the time he'd ordered the proper tests and treatments, it had almost been too late. That patient had survived, barely. But Preston had never forgotten the look in the man's eyes, the same evaluating gaze he saw now in Marcus Johnson's face, the same unspoken question. Will you see me as a patient, or will you see me as something else first? His pressure's up to 175/98, Carmen said quietly, checking the vital signs on her tablet. Michael, whatever this is, whatever you're wrestling with, he doesn't have time for it. Preston ran a hand over his face. Get a nitro drip ready and call cardiology. Back in room 12, Johnson's composure had cracked slightly. His breathing was more labored, his face ashen. Yet when he spoke, his voice remained measured, professional. Dr. Preston, I apologize if my earlier comments seemed presumptuous. I understand the challenges of emergency medicine, the need to avoid bias from patients who think they know. I'm starting you on nitroglycerin, Preston interrupted. This time, the interruption wasn't defensive. It was urgent. And I need to do a proper exam, right now. As Preston finally pressed the stethoscope to Johnson's chest, he forced himself to focus solely on the medical facts. Heart sounds irregular, breath sounds diminished at the bases. The EKG showed ST elevation in leads 2, the 3, and AVF. Classic inferior MI, Johnson murmured, reading the EKG strip upside down. Indeed. Preston found himself almost smiling at the typical doctor as patient behavior. We're calling cardiology. You'll need the cath lab. I know. Johnson's clinical facade cracked further. My father, he died of the same thing, 46 years old. I always knew. But you made it here in time, Preston said firmly. And you were right, about all of it. The symptoms, the nitro, the likely diagnosis. I should have listened sooner. Johnson's eyes met his, and in them Preston saw not accusation, but understanding. We all have our blind spots, doctor. The question is whether we're willing to recognize them. Carmen returned with the nitro drip and additional medication orders from cardiology. As she worked, Preston found himself really looking at his patient for the first time. The wedding ring, worn smooth with years. The family photo set as the lock screen on his phone. Johnson with a teenage daughter in a graduation gown, both beaming. The Harvard Medical School ID badge that spoke of decades of dedication to healing others. Your daughter, Preston said, gesturing to the phone. She's in college. Started at Yale this fall. Despite his pain, Johnson's face softened with pride. Pre-med, though I told her she should consider emergency medicine instead of neurobiology. More direct impact on people's lives. The words hit Preston like a physical blow. Here was this man, in the midst of a heart attack, still thinking about impact on others' lives, still seeing the bigger picture that Preston had momentarily lost sight of. Dr. Johnson, he began, but was interrupted by the arrival of the cardiology team. As they prepared to move the patient to the cath lab, Johnson caught Preston's sleeve. Doctor, thank you for seeing what needed to be seen. Preston watched them wheel Johnson away, Carmen still at his side monitoring his vitals. In the momentary quiet that followed, he found himself thinking about sight, about what we choose to see first, what we overlook, what we deliberately blur. His pager buzzed, another chest pain in room 15, female, 68, hypertensive. As he walked toward the new patient's room, Preston found himself wondering what else he might have missed over the years, what other barriers he might have unconsciously erected. The rest of Preston's shift passed in a blur of patients and procedures, but his mind kept returning to room 12, to that moment of hesitation, of recognition, of change. Each new patient seemed to carry a different weight now, as if Johnson's words had adjusted the prescription of lenses through which he viewed his emergency department. Around 3 a.m., Carmen found him in the doctor's lounge, staring into a cold cup of coffee. "Just got an update from the cath lab," she said, dropping into the chair across from him. "Dr. Johnson's procedure went well. They placed 2 stents. He's stable." Preston nodded, relief washing over him. "Good, that's good. Want to talk about what happened earlier? Do I have a choice?" Carmen's laugh was gentle but knowing. "After 12 years? No, not really." Preston set down his coffee cup, struggling to find the right words. "Did I ever tell you about my first year as an attending? There was this patient—" "James Wilson," Carmen interrupted. "Cook County Hospital. You've mentioned him before." Preston blinked in surprise. "I have?" "Every few years, usually after a difficult case, always when you're questioning yourself." She leaned forward. "But you've never told me the whole story." Preston closed his eyes, remembering. Wilson was a lot like Johnson, educated, articulate, came in with chest pain. I was young, overconfident. I saw a black man in an expensive suit and I thought he was drug-seeking, by the time I realized he was having an actual heart attack. But he survived. Barely. And you know what he said to me afterward? He said, "Doctor, I forgive you, but you have to forgive yourself too. Just promise me you'll learn from this." Carmen was quiet for a moment. "Did you? Learn from it?" "I thought I had." Preston ran a hand through his graying hair. "I've spent 20 years telling myself I'm not that same arrogant resident, that I've moved past those biases. But today, with Johnson, for a moment, I was right back there in Cook County. The difference," Carmen said softly, "is that this time you caught yourself. This time you saw it happening." Before Preston could respond, his pager went off again. Another chest pain, room 4. As he stood to leave, Carmen caught his arm. "The patient in 4, she said. "Maria Gonzalez, 62, diabetic, doesn't speak much English. Her granddaughter's translating." She paused. "Just see her, Michael. Really see her." The next few hours brought a steady stream of patients. Maria Gonzalez with her devoted granddaughter, a homeless man with infected frostbite, a transgender teenager with severe abdominal pain. With each case, Preston found himself pausing, really looking, really listening. The extra moments spent gathering history, the careful attention to not just symptoms, but stories. It changed something in each encounter. Dawn was breaking when his phone buzzed with a text from the CCU. Dr. Johnson was awake and asking to speak with him. Preston found himself hesitating outside the cardiac care unit, much as he had outside room 12. But this time, the hesitation wasn't about bias or barriers. It was about facing something in himself that he'd tried to ignore for too long. The CCU was quiet except for the steady beeping of monitors. Johnson was propped up in bed, his wife asleep in the chair beside him. The morning sun cast long shadows across the room, making everything seem softer, more contemplative. "Dr. Preston," Johnson said, his voice hoarse but clear. "Thank you for coming." Preston moved to check the cardiac monitor, falling back on familiar medical routine. "Your numbers look good. The stents are—" "That's not why I asked to see you." Johnson shifted slightly, wincing. "I wanted to tell you about something that happened to me 15 years ago." Preston found himself sinking into the empty chair on the other side of the bed. Something in Johnson's tone commanded attention. "I was working in the ER at Mass General," Johnson continued. "Young attending, full of myself. This white teenager came in, obvious signs of withdrawal. He paused, collecting himself. "I made assumptions, treated him like just another junkie, didn't look deeper." Preston felt his chest tighten, recognizing the story's shape. Turned out he had a rare autoimmune condition. The withdrawal symptoms were actually his nervous system attacking itself. By the time another doctor caught it, Johnson's voice trailed off. "He survived, but with permanent damage, and I've carried that with me every day since." "Why are you telling me this?" Johnson's eyes met his, keen despite the medications and fatigue. "Because I saw something in your face yesterday. The same thing I see in the mirror sometimes. That moment of recognition, not just of bias, but of the constant battle against it." Preston thought about Carmen's words, about seeing and being seen. I almost made the same mistake yesterday that I made 20 years ago. But you didn't. Johnson's wife stirred in her sleep, but didn't wake. You caught yourself. That's the difference between good doctors and great ones. Not that we never have biases, but that we learn to recognize them, to fight them, to grow past them. A nurse appeared with morning medications, pausing their conversation. Preston watched as Johnson swallowed the pills, noting how, even as a patient, he checked each medication name and dosage. Once they were alone again, Johnson spoke softly. My daughter, the one starting pre-med, she wants to research healthcare disparities. Says she's seen too many stories like mine, like yours. Too many moments where someone's life hung in the balance of another person's assumptions. Preston thought about all the patients he'd seen since his encounter with Johnson. Maria Gonzalez with her quiet dignity, the homeless man whose frostbite revealed a deeper story of job loss and mental illness, the scared transgender teen whose parents had thrown them out. I have a weekly teaching session with the residents, Preston found himself saying. Would you, once you're recovered, would you consider speaking to them, sharing your perspective as both a doctor and a patient? Johnson's face lit up with interest. Only if you'll share your story too. They need to hear both sides, how bias can blind us, but also how we can learn to see past it. Outside the CCU, the hospital was coming alive with the morning shift change. Preston could hear the familiar sounds of another day beginning, monitors beeping, phones ringing, families arriving to visit loved ones. But something felt different. He thought about all the patients yet to come through his emergency department doors. 6 weeks later, Preston stood before a room full of emergency medicine residents. The young faces looking back at him reminded him of himself at their age, eager, confident, certain they knew how to navigate the complexities of emergency medicine. Before we begin today's session, he said, I'd like to introduce a colleague. Marcus Johnson walked into the room, looking remarkably recovered. He carried himself with the same quiet dignity Preston remembered from that night in room 12. But there was something else now, a shared understanding between them that went beyond professional courtesy. Many of you know Dr. Johnson as a respected neurobiologist, Preston continued. Today, he's here to help us understand something equally complex, ourselves. For the next hour, they shared their stories. Johnson spoke first, describing not just his recent heart attack, but his own journey of recognition and growth. He talked about the young man he'd misdiagnosed years ago, about how that moment had shaped his approach to medicine. Then Preston took his turn. He told them about James Wilson at Cook County, about his own near mistake with Johnson, about the daily challenge of recognizing and confronting their own biases. The thing is, Preston said, looking at the now silent residents, medicine gives us protocols for everything. Chest pain? Here's your algorithm. Stroke symptoms? Follow these steps. But there's no simple algorithm for seeing past our preconceptions. A young resident raised her hand. But how do we know? In the ER, we have to make split-second decisions. We rely on pattern recognition, on statistics, on probability. That's true, Johnson answered. But there's a difference between using clinical data and letting unconscious bias guide our decisions. He glanced at Preston. Sometimes, the most important vital sign is the one we measure in ourselves. After the session, Carmen was waiting outside the conference room. She'd taken her break to observe the teaching session, something she'd never done before. That was something, she said, falling into step beside Preston as they walked back to the ER. Those residents were really listening. They better have been, Preston replied, because... He was interrupted by his pager. Chest pain, room 9. Without thinking, he quickened his pace, but Carmen caught his arm. Michael, she said softly, remember what you just taught them. The patient in room 9 was an elderly Asian woman, accompanied by a younger man who introduced himself as her son. The woman was clutching her chest, speaking rapidly in Mandarin. 6 weeks ago, Preston might have immediately called for a translator, maintaining professional distance while waiting for linguistic clarity. But now, he found himself really looking at his patient. At the fear in her eyes, at the son's protective hovering, at the half-eaten container of hospital cafeteria food that suggested they'd been waiting a while. Sir, he said to the son, please tell your mother I'm going to help her. But first, I'd like to know her name, and to understand her story. As the son translated, Preston caught sight of Johnson passing by the door. Their eyes met briefly, a silent acknowledgement passing between them. Then Preston turned back to his patient, ready to truly see her. The woman's name was Lin Wei, and through her son's translation, Preston learned she was a retired physician herself, a pediatrician who had practiced in Beijing for 40 years before joining her son in Boston. As Preston conducted his examination, she made subtle gestures he recognized as the ingrained habits of a fellow doctor, unconsciously noting his technique, tracking his methodology. "Your mother," Preston said to the son, David, while listening to Mrs. Lin's heart sounds. "She's evaluating me, isn't she?" David smiled tiredly. "She can't help it. She says old doctors never stop being doctors." Preston found himself thinking of Johnson, of how being on both sides of the stethoscope had changed his perspective. Tell her I welcome her professional opinion." When this was translated, Mrs. Lin's entire demeanor changed. She began speaking rapidly, her son struggling to keep up. "She says there's a particular quality to the chest pain. Not just pressure, but a sensation she's never encountered in her patients. She's concerned because it doesn't fit the typical patterns she studied." As they worked together, patient, son, and doctor, Preston felt something shift in the room. This wasn't just about gathering symptoms anymore. It was about sharing knowledge, bridging experiences. Later that night, after Mrs. Lin had been admitted for observation, her symptoms suggested possible atypical angina. Preston found himself in the doctor's lounge again. He was updating her chart when Johnson appeared in the doorway. "I heard about your patient in 9, Johnson said, settling into a chair. "The retired pediatrician?" Preston looked up. "News travels fast. Carmen mentioned it, said something about watching you learn a new language." "A new language?" Johnson smiled. "The language of seeing beyond our first assumptions, of recognizing the doctor in the patient, the teacher in the student." He paused. "The human in everyone who walks through those doors." Preston thought about how differently this day might have gone 6 weeks ago, how many stories he might have missed, how many connections left unmade. "You know," he said slowly, "Mrs. Lin said something interesting, through her son, about how medicine in China focuses on seeing patterns in the whole person, not just in the symptoms, how every diagnosis tells 2 stories, the medical one and the human one." "And which story were you reading today?" Before Preston could answer, his pager went off again. Multiple car accident coming in, several critical patients. As he stood to respond to the trauma call, he felt Johnson's hand on his shoulder. "Remember," Johnson said quietly, "every patient in those incoming ambulances has both stories too." The emergency department erupted into controlled chaos as the accident victims arrived. Preston moved from patient to patient, directing care, making split-second decisions. But with each interaction, he found himself automatically noting not just the medical details, but the human ones. Among the accident victims was a young black man in a delivery driver's uniform, unconscious with a severe head injury. As Preston worked to stabilize him, he noticed the phone that kept lighting up in the man's torn jacket pocket, missed calls from Mama flashing repeatedly on the screen. "Someone needs to call his mother," Preston said to Carmen, who was assisting him. "She should know he's here." "Already done," Carmen replied. "But that's new for you. Usually in traumas, you're all medicine, no extras until the patient's stable." Preston's hands remained steady as he worked, but his mind was racing. "What else do we know about him?" "Marcus Williams, 24, was making his last delivery of the night when the accident happened. Had a passenger, his little brother. They're working on him in Trauma 2. The information hit Preston hard. 2 brothers out working late at night. He thought about all the assumptions someone else might make about that scenario, all the stories they might tell themselves about why these young men were really out at this hour. But Preston saw something else now. The worn work uniform, the carefully maintained delivery vehicle he'd glimpsed being towed away, the phone full of worried calls from a mother. He saw people trying to make a living, a family supporting each other, dreams and responsibilities intertwined. In Trauma 2, he found Johnson had been called in to consult on the younger brother's neurological status. Their eyes met over the unconscious form of the teenage boy, and without words, Preston knew they were thinking the same thing. How easily these lives could be reduced to statistics, to assumptions, to quick judgments that might affect their care. "His name is Trevor," Johnson said quietly. He's 16. Was riding along with his brother to earn extra money for college applications. Preston nodded, examining Trevor's pupils. We need to get them both to CT, and... He paused, making a decision. I want them in adjoining rooms in the ICU. Their mother shouldn't have to run between floors to check on her boys. Hours later, as dawn broke over Boston again, Preston sat completing his charts. Both brothers were stable, though Marcus would likely need surgery once the swelling in his brain decreased. Their mother had arrived, a dignified woman in nursing scrubs who had clearly come straight from her own night shift at another hospital. Dr. Preston? He looked up to find Mrs. Williams standing there, exhaustion and worry etched on her face. I wanted to thank you, she said softly. The other nurses told me. They said you made sure my boys stayed together, that you've been checking on them even after your shift ended. Preston thought about how to explain what had changed in him, how to tell this worried mother that her sons had received the best care not just because of medical protocols, but because someone had finally learned to see clearly. I had some good teachers recently, he said finally. They helped me understand that medicine isn't just about treating symptoms. It's about seeing people, really seeing them. Mrs. Williams nodded slowly. You know, Marcus, my older son, he wants to be a doctor too. Says he wants to help people who look like him get better care. She paused. Would you be willing to talk to him about that once he's recovered? Preston felt something shift in his chest as he remembered another doctor, another bedside conversation about changing perspectives. 3 months later, Preston stood in the doorway of room 215, watching Marcus Williams leaf through a medical school brochure. The young man's recovery had been remarkable, thanks in part, Preston had to admit, to his own heightened attention to every aspect of his care. Harvard's a reach, Marcus was saying, his voice stronger now, but still carrying traces of fatigue. But Dr. Johnson says with my engineering background and his recommendation, You're selling yourself short, Preston interrupted. Your test scores are solid, your recovery story is compelling, and you've got 3 different doctors ready to write recommendations. He paused. Including me, if you want it. Marcus looked up, surprise flickering across his face. You'd do that? Preston thought about his own journey over the past few months, about the weekly meetings he and Johnson had started with residents, teaching them to recognize and challenge their own biases, about Mrs. Lin, who now volunteered as a cultural consultant to the hospital's Asian outreach program, about how one moment of recognition, of truly seeing another person, could ripple outward in unexpected ways. Actually, Preston said, pulling up a chair, I'd like to do more than that. We're starting a mentorship program, connecting pre-med students with working physicians, helping them navigate not just the application process, but all the unwritten rules of medicine. He watched Marcus process this information, seeing the same keen intelligence that had helped the young man survive and thrive these past months. Is this because of what happened with Dr. Johnson? Marcus asked. I heard the nurses talking about it. Partly, Preston admitted, but it's also because of what happened with you, with your brother, with every patient who's taught me that medicine isn't just about what we know, it's about what we're willing to learn. Down the hall, he could hear the familiar sounds of the hospital, monitors beeping, nurses calling out vitals, families visiting loved ones. But these sounds carried different meanings now. Each beep was a life story, each conversation a chance to understand more deeply. Your mother, Preston said suddenly, remembering something. She told me once that you wanted to help people who look like you get better care, but I think maybe you'll do more than that. Maybe you'll help doctors like me learn to see all patients more clearly. Trevor appeared in the doorway then, no longer the scared teenager from the trauma bay, but a young man with purpose. Marcus, Mom's here with the discharge papers. You ready to go home? As Preston helped Marcus gather his things, Johnson appeared with final paperwork. The 2 doctors exchanged glances, remembering their own shared moment of understanding months ago. You know, Johnson said to Marcus, Harvard's diversity recruitment officer owes me a favor. Perhaps we should give her a call. Preston watched the interaction, thinking about chains of events, about how one moment of recognition could lead to another and another, about how change happens not in grand gestures but in small moments of seeing clearly. 1 year later, Preston sat in the front row of Harvard Medical School's white coat ceremony. Among the incoming class of aspiring doctors, Marcus Williams stood tall, his mother and brother beaming from the seats beside Preston. Dr. Johnson was on stage as part of the faculty, preparing to help coat the new students. As Preston watched the ceremony unfold, his mind drifted back to that night in room 12 when a respected doctor had become an emergency patient, and an emergency patient had become an unexpected teacher. He thought about how close he'd come to missing that lesson, to staying locked behind the barriers of his own assumptions. The changes that had rippled out from that night were still spreading. The mentorship program he and Johnson had started now included 15 hospitals across Boston. Mrs. Lynn had helped develop a cultural competency curriculum that was being adopted by other emergency departments. Carmen had been promoted to director of nursing, where she made sure every new hire understood that seeing patients clearly was as important as seeing their symptoms. And there had been personal changes too. Preston's approach to medicine had transformed. He spent more time listening, really listening to his patients' stories. He'd learned to recognize the moments when his old biases tried to surface, and to consciously push past them. His patient satisfaction scores had risen, but more importantly, his understanding of his own role as a healer had deepened. When Marcus's name was called, Preston felt his throat tighten with emotion. The young man walked across the stage with the same quiet dignity his mother had shown during those long nights in the ICU. As Johnson helped him don his white coat, their eyes met in shared understanding, both of them knowing that this moment represented not just one student's achievement, but a deeper change in the system itself. After the ceremony, Preston found himself surrounded by familiar faces. Mrs. Williams hugged him, tears in her eyes. Trevor, now a pre-med student himself, eagerly discussed his upcoming hospital internship. Johnson stood nearby, watching with satisfaction as his newest student celebrated with his family. "Dr. Preston," Marcus said, his new white coat gleaming under the auditorium lights, "I never properly thanked you. Not just for saving my life, but for showing me that change is possible, that we can make medicine better, one doctor at a time." Preston shook his head. "I should be thanking you. You and your family, Dr. Johnson, every patient who helped me learn to really see." He paused, looking around at the crowd of new medical students, each with their own stories, their own perspectives to bring to medicine. We talk about healthcare disparities like they're this huge, unsolvable problem. But maybe the solution starts with something simpler, learning to see each patient, each person, clearly and completely. Johnson stepped forward, placing a hand on Marcus's shoulder. "The badge is a bridge, not a barrier," he said, quoting the words that had become a mantra in their teaching sessions. Or, in this case, perhaps the white coat is a bridge. As Preston watched Marcus join his fellow students, all of them embarking on their medical careers with fresh idealism and hope, he thought about how change happens. Not all at once, but person by person, moment by moment. One clear-sighted interaction at a time. The emergency department would be waiting for him tonight, full of new patients, new stories, new opportunities to see beyond his first assumptions. But now he had something he hadn't had before. The knowledge that every patient was a potential teacher. Every interaction a chance to build a bridge rather than a barrier. And in the end, that was what healing was really about. Not just seeing symptoms and prescribing cures, but seeing people in their full humanity and helping them write the next chapter of their stories. As he headed back to his shift at Boston General, Preston smiled, knowing that somewhere in the hospital tonight, there would be another doctor, another patient, another moment of choice between seeing and truly seeing. And maybe, just maybe, his own journey would help light the way for others to make the right choice.